And as you see, there was an improvement in the situation of central macular thickness also for this kind of patients. And the other point was that after 3 years, the improvement obtained was maintained. That's an important point, no? Because if you have a patient which is affected by the disease for so long, you need to know how things are going after a long time after the start of the study, please. There are a lot of studies. This is another phase 2 study, Resolve, where again ranibizumab was compared with nothing. Go ahead. And also in this case, there was an improvement of 2 lines of visual acuity with the TDRS charts. And this is the Restore trial. This is a phase 3 trial where the 2 different dosages were compared with laser. So not with nothing, but with the gold standard used at that time. So you have a group which is only the drug, and this is because laser is simulated, it's not effective. Another group is ranibizumab plus laser to see if the combination of the 2 was able to improve the effect of treatment. And the third one was sham injection plus active laser. So you have laser, drug plus laser, and drug only. These are the 2 groups that, the 3 groups that were considered for this study. Please go ahead. And these are, go ahead, the results of the study. If you see after 1 year, the 2 groups where injections were done were significantly better than the group treated with laser. After the first year in this study, it was possible to start to inject the eyes. So these eyes were assigned first to laser, and after the first year, injections of Lucentis were possible on the basis of the edema of the patient. So what was evident is that when you started to inject Lucentis, also in eyes already treated with laser, you could obtain again an improvement in visual acuity. So the message is, if possible, start with the injections, but if you are late, do anyway the injections because you can have an improvement in visual acuity. And this is the evidence of that. Go ahead. Okay, go ahead. I think we need to be fast now. The concept is, anyway, I would like to address you the message. The take-home message is, today we know on the basis of many multicentric trials that if you have a patient with diabetic macular edema, you can significantly improve visual acuity in these patients using these kind of injections. Ranibizumab injected inside the eye can significantly improve visual acuity in these patients. This is something completely new for us. Our patients, till some years ago, were treated only with laser, and visual acuity was anyway declining. Laser was able to reduce this decline of visual acuity, but was not able to improve visual acuity. So this is something new. Okay, there is evidence also for some other anti-VEGF drugs, such as Macugen. Unfortunately, Macugen at the moment is not produced, I think, by the company, but disappeared from the market. Please go ahead. These are results obtained with this other drug. Also in this case, there was some evidence that pegaptanib, which is the name of the drug, the commercial name was Macugen, was effective to improve visual acuity in patients with diabetic macular edema. Okay, go. But there is also some new other drug, and this is the name of the new drug, Eylea, which is VEGF-Trap, which seems able to produce the same kind of results. Also with this drug, it's possible to have an improvement in visual acuity. So the future will be better than today. We will have different guns to be used against this dramatic complication of diabetes mellitus. And these are the results which are similar. They parallel more or less the results obtained with Lucentis. There is another family of drugs, steroids, which are also having good results in patients with diabetic macular edema. The evidences that we have today for Ozurdex, which is one of these, is less important, less strong than what we have with anti-VEGF drugs. Go ahead, please. But anyway, also with Ozurdex, it was possible in one trial only at the moment to show that you can improve visual acuity using this kind of drug. Also in eyes already vitrectomized. Vitrectomized means that the eye was already treated with the vitrectomy, which is a surgical procedure by which you can eliminate the vitreous body from the eye. And in these eyes, where the other kind of therapies are not effective, because you don't have the vitreous body that grasp the drug, but the drug inside the water is immediately metabolized and eliminated from the eye. Also in these eyes, using this Ozurdex drug, you can have some improvement in visual acuity. That's another kind of steroid, Iluvien. It's a new one, and it was shown in a study that this kind of drug, injected inside the eye in diabetic macular edema, is able to produce a significant improvement in the prognosis, but unfortunately associated with a high percentage of complications. Please. And these are the results where you can see that you have a significant improvement of visual function. Go ahead. And I don't know if here you have mentioned the results, the complications, but anyway, yes. Go back. There was an increase to 30 millimeter, which means a significant increase in the intraocular pressure in a high percentage of eyes after 3 years. And there was a high percentage of cataract, 80%, which is a huge number, more or less. The great majority of the eyes had developed a cataract after 3 years. Please. This is a study done with Avastin, but with lower number, but also for Avastin. There is some evidence that you can improve diabetic macular edema. This was done by South American colleagues in a multicentric trial organized by them. Okay. Go. So the message to be left to you is you can improve the prognosis of diabetic macular edema using anti-VEGF drugs. We have evidence on that. And the best evidence, the most important evidence are with ranibizumab. But we are starting to have evidences also for the other anti-VEGF drugs. It's important to be considered this option of treatment in order to improve prognosis for this huge number of patients with diabetes. Go ahead. I think that's finished.